I'm glad that he's back here again. This is not his first time. From Maui Memorial Trauma Medical Director and General Surgeon at Maui Memorial Medical Center, Dr. Caesar Ursic. Am I saying that correctly?
That was perfect, Shane.
For real?
Exactly right.
Because it's been a while since you was here, so you know what I mean? I got to make sure I get it correct.
Back at Christmas.
Yeah, I know. Well, it's not too long.
No, that's nothing.
Well, you should be here every month.
I'll come every day.
Dr. Caesar, thank you for joining us. Now, March is Brain Injury Awareness Month. Why is raising awareness so important in that area?
Well, many reasons, but the main ones are people need to be aware that the brain injury is one of the worst, if not the worst injuries that we can have. So if I break my leg, or even if a shark cuts off my leg, I can get an artificial leg and I can move on with my life, and many people do, and it's not as bad. But a brain injury changes who we are, what the essence is of our humanity, because that's how we think. It's our personality. It's our way we relate to other people. So that's why brain injuries are so severe, and we want to bring this to the attention of people so that they can understand how important it is and how they can possibly prevent it. That's true. That's the biggest thing, is prevention.
And through education, of course. When I was a youngster, I didn't need a helmet. I just did what I did. Thank the good Lord that my head is still intact. And, but yeah, it's something that we kind of overlook because, we're not thinking, if you get what I'm saying. We're not thinking,
and when we're young, I did it too. We think we're immortal, right? Nothing's going to happen to us. And Hawaii is one of the states where we can ride a motorcycle or a moped, and if we're over the age of 18, we don't have to wear a helmet. We won't get a ticket. So it's a little more serious here sometimes than other states where they have helmet laws and people are forced to ride it with a helmet. Now, it's can get political, but just from a medical standpoint, we know that helmets prevent head injuries.
Yeah, for sure. What are common causes of brain injuries, doctor, and how can they be prevented?
Well, interestingly, the most common cause of head injury is just tripping and falling and hitting our head. When we're standing up, we fall, but that's enough of a distance where we see the majority of our head injuries in the trauma center from falls. And that can be, usually it's mostly in our older patients, because as we get older, we tend not to be as strong. Our flexibility goes down, our coordination, and it doesn't take much, and boom, you're on the ground, hit your head. But the other common reason is vehicles. Cars, motorcycles, mopeds, skateboards, those types of things. And then after that, you name it. People getting in fights.
Yeah, well, doctor, I'm just going to throw this at you. Where does sports injuries land in all of that? Or do they stand alone?
Sports injuries. So during football season, we see quite a few of our young folks coming in with concussions and occasionally a serious head injury. Motorcycles and bicycles, big deal. Our population of tourists who come down and get on the bikes and go down Haleakala, we see them, and they can sometimes be in the hospital for weeks, if not months, with really bad head injuries. So sports is, it's its own area. Our younger population is more vulnerable because more of them are playing sports, contact sports.
That's true. What are the signs and symptoms of a brain injury, Doc?
Well, like any injury, it can be very mild, very subtle, or it can be obvious to anyone. So let's start with the subtle ones. It could just be a headache and difficulty maybe speaking clearly or asking the same question, repetitive questioning. These are clues that family members can use to say, hey, Grandma just fell a couple of hours ago and she's just acting a little weird. Her headache. She doesn't want to come and sit down and have dinner with us. Things like this. So little changes in behavior, all the way over to severe head injuries where there's immediate loss of consciousness. People black out and they don't wake up. And those are the ones where, of course, we're the most worried. We have to get them into the hospital, get them scanned. And then if there is something going on that needs surgery, we have neurosurgeons who are able to address head injury by opening the skull and removing clots. Those are severe examples. But the things to be aware of is just a change in behavior in a person who was acting normally, and now they're a little bit off.
Maybe off.
Yeah.
Well, hopefully we don't have to come to that point or experience that. But if we do, these are signs and information that we need, and educating our listeners this morning, our local people, so that they can remind our tourists that, hey, we all should be using a helmet or be as safe as possible, no matter where.
It's a good choice. It's
and
a good choice.
when you said about the percentage of injuries were just falling, first thing came to my mind was our kupuna. It happens often for our kupuna. So, as us younger ones, right, doctor, we need to be aware of that and take care of our kupuna.
Once we hit 50, our bodies unfortunately start to change. And so the best thing I think people 50 and above can do is to stay flexible and try to stay strong. So staying active is important. But you know what helps? Stretching. Keeping our joints limber and moving, because when we get stiff, that's when we can't react. A little trip becomes a big fall. We can't recover. So keeping our joints, yoga, whatever it is that you like to do, it's going to help.
I'll take that. Dr. Cesar Ursic, thank you so much for coming here in person.
Thank you, Shane. You're doing God's work, and we appreciate it.
Thank you. I'm trying to do my best. You know the address. You can always come back.
Okay.
All right.
Thank you.
Aloha.